Hello, I'm Dr. Donald Schleicher. I'm a neurosurgeon with Regional Brain and Spine based out of Cape Girardeau, Missouri. The sacroiliac joint is the joint in between your iliac crest and your sacrum. In patients with chronic low back pain, oftentimes we see that the sacroiliac joint is involved in approximately 15 to 30% of the time. In patients that have had prior lumbar surgery, and if they have continued low back pain, we have noticed that the sacroiliac joint has been involved approximately 40% of the time. When I see a patient in my office with sacroiliitis, oftentimes they come in with chronic low back pain, localized specifically to about the belt line, just lateral to the midline. Some patients do have referred pain from the sacroiliac joint that does go into the gluteal region as well as to the anterior thigh. Some of the common complaints that I have from my patients are they have a grinding sensation in the region. They also have popping sensation. I've even had a couple of patients state that they feel like their SI joint pops out of place and it needs to be put back into place by either physical therapists or chiropractors. In my practice, when I have a patient that comes in with chronic low back pain, I like to do a complete workup that involves all of the joints that move, not just the lumbar spine and the hip. We will obtain a full history and physical, we will do a complete examination, as well as obtain baseline imaging. If at that time we don't see any lumbar pathology, then we start to look for other common causes of low back pain, including the sacroiliac joint. Specifically for the sacroiliac joint, there's tests we can do. All of them involve loading the sacroiliac joint, as well as certain pressures on the iliac crest as it relates to the sacroiliac joint, and oftentimes if that elicits pain, then we start to investigate the sacroiliac joint as the pain generator for these patients. Once a patient is diagnosed with sacroiliitis and is identified that the sacroiliac joint is the cause of their pain, they are sent for conservative measures, including pain service, for injections, and physical therapy. If they do not have a long-term relief of their pain, iFuse system now allows us to have a minimally invasive approach for a surgical correction of this disease process. I personally use the iFuse system. I like the iFuse system because approximately 85% of my practice is minimally invasive. The iFuse system goes through the lateral aspects of the gluteal muscle, and it's done through approximately a 2 to 3 centimeter incision. It does not go through the ligaments that stabilize the joint. It goes through a lot of the muscle tissue that heals very well and very fast. The structure of the implants are triangular in shape. In my practice, I have noticed that the vast majority of my patients are very happy with this procedure. They're happy with the pain relief that comes with this procedure, and they would, if given the choice, go through the surgery again. If you have chronic low back pain, you don't have to suffer alone. You can come in and be evaluated by myself in our clinic at Regional Brain and Spine.